What's a normal day in rehab like? Residential inpatient treatment centers tend to be very structured and organized, with similar activities and therapies in most centers. This minimizes stress and uncertainty among residents. It also allows for the safest and most supportive environment for healing and recovery. Depending on the setting and the amenities offered, daily activities can vary, but most centers are pretty similar. So here's how a typical day in treatment looks like at my rehab, Asana Recovery. Let's start at the beginning. You have to get up, right? Sleeping in is not part of the program, so expect to rise early in the morning. Part of the treatment and recovery process focuses on developing new, healthy habits that are intended to become routine in post-discharge life, like getting up on time. Do it for you, not anybody else. After you hopefully brush your teeth, we then have a morning yoga or meditation session to help you begin the day in a relaxed state of mind. That's followed up by a tasty and nutritious breakfast. What is a typical day in rehab? There's usually a group session following breakfast, led by a counselor or therapist. This session focuses on topics related to addiction and recovery, like your triggers or the 12-step process. A significant focus during treatment is on achieving clarity about the issues, people, and surroundings in your life that have fueled the desire to abuse drugs or alcohol. The middle of the day provides the most intensive treatment. After a healthy lunch, it is typical to begin a series of therapeutic sessions, which can be of several different types. Cognitive behavioral therapy hones in on your behavioral responses to specific triggers. Once those are identified, the therapist will guide you toward new, healthier responses to those triggers. The one-on-one therapy sessions provide a safe environment for you to feel free to open up and share your fears and concerns. Group therapy is another type we're probably all familiar with. Participation in group therapy provides a certain camaraderie, as all patients have experienced the struggles of addiction. It can be very beneficial to the participants to share their personal stories with one another to allow for emotional healing. The group members often develop a sense of fellowship during the weeks in rehab, and as trust grows, they become more open in their sessions and develop a sincere compassion for each other's battles. Depending on your individualized treatment plan, you may also have a specialized session. These could be tailored for anger management, stress management, or grief counseling. These specialized sessions help you to develop coping techniques that improve your ability to handle issues in a controlled manner, rather than feeling the need to use drugs or alcohol. Some days you will also get to go to the gym or do something different, like music therapy, art therapy, or equine therapy. In addition to therapy, we also sometimes have speakers who share their own stories, offering residents a sense of hope about their own future. Sometimes the speakers delve into practical issues like rebuilding careers post-treatment, or simply offer inspirational speeches to help lift spirits. After a great dinner, the evening is usually less structured. You may be able to go to an outside 12-step meeting, or maybe just chill at the house and watch a flick. One of the great things about Asana are the fun and interesting weekend activities. This could be hiking, surfing, beach volleyball, go-karting, bike riding, and other cool things. At Asana, I met a lot of great people and learned how to change my old behaviors on a daily basis. Today, I'm clean and sober for over a year. I never thought that was possible for me. Go in with an open mind and be willing. Do it for you, not anybody else. If you have any questions about detox or residential treatment for yourself or a loved one, contact us at Asana Recovery today. And good luck on your recovery journey.